Good morning and welcome to this meeting of the Audit and Performance Committee of the Perth and Kinross Integration Joint Board. I'd first like to apologise for our lateness in starting this morning. We've been having a number of technical issues that have prevented some members and officers from joining. To start, I'll pass over to Adam Taylor from Committee Services to ask if there are any apologies for this meeting.
Yeah, thanks, Chair. This morning we've had apologies submitted from Councillor Duff, Bernie Campbell and also from Scott Henry. Okay,
thank you. Can I ask if there are any declarations of interest from members today in relation to any of the items of business on the agenda? I'll take that silence to mean no. Okay. If we move on now to item 3 and first 3.1, which is the minute of the Audit and Performance Committee, which was held on the 14th of September. Can I ask if members are happy that this is an accurate record of the meeting?
Yeah, I'm happy with it.
Okay, thank you. So if we move on therefore to item 3.2, which is the action points update from that meeting, can I ask the Chief Financial Officer if there's anything she wants to say in relation to this update?
Apologies, Chair, I'm just trying to organised papers following the technical issues this morning. There's nothing specific to say. There are obviously still a number of items on the list. If I could just take members through them quickly. In relation to reference number 40, in relation to a risk champion, and after due consideration, we propose not to take forward a risk champion at this time. We have had discussions with Perth and Kinross Council and NHS Tayside about their arrangements around risk, and that would be consistent with that, albeit that we would seek to review that perhaps at some point in the future. I would note in relation to item 41 that whilst we had committed to circulate a briefing in relation to absence rates, that's actually not gone out yet. So I would want to amend the action note to reflect that, and we will be seeking to get that out this week. That's just down to workload issues within the team in terms of getting that out to members. So apologies for that. So that's a change that we would like to make there. In relation to hosted services, we have made the proposition within the comments that we are now actively seeking to bring reports on all hosted services, including those hosted by Angus and Dundee, within our quarterly performance reporting, and we're now already in discussions with colleagues in both partnerships to consider how best to do that, and that will ensure that the Audit and Performance Committee receive updates routinely as part of the wider performance report. In relation to the discussions with the Chief Internal Auditor, with Pat Kilpatrick, I don't believe that that's happened, and Jackie Clark may wish to comment on progress in getting that into the diary. And in relation to benchmarking, the quarterly performance report currently includes benchmarking across the whole of Scotland, and we don't seek to expand that at this point, but we will keep that under review. So those were the comments on the action notes this morning.
Okay, thank you, Chief Financial Officer. Can I ask members if there are any matters arising from the minute, or whether they have any questions or comments on the action points?
Can I come in, Callum?
Yes.
I think it's not that I think we have a meeting with the Chief Internal Auditor tomorrow at 10 o'clock. So that has been organised.
Okay.
Just to let Jane know as well. So yeah, that's gone ahead. We just had some difficulties with dates, but we've got it in the diary now.
Great. Any further questions or comments on either of those two items? No? Okay. If we move on, therefore, to section 4 of the agenda, which is the governance and assurance section, the first paper is item 4.1, which is the audit recommendations update, and I'll ask the Chief Financial Officer to introduce this report.
Thank you, Chair. I'm pleased to bring the paper before you today. I'm also pleased to note that the number of overdue recommendations within the report today has, in overall terms, reduced by 3, and that's with 6 recommendations coming onto the report from new recommendations that have been made, both within the external audit report and the performance management report, which both came to the Audit Performance Committee at the last meeting. But we are making progress overall in reducing our outstanding audit recommendations. There do remain, however, a number that are still overdue, and I was just going to take members quickly through those in terms of an update. Reference number 24, the outstanding recommendation around our strategic planning arrangements. The intention is that a full report will come to the December IJB meeting that will give an update on our strategic planning arrangements at that meeting, although I would note that the current agenda is under discussion due to the need to accommodate a further item in relation to inpatient mental health. In relation to item number 34, in relation to corporate support, again, that one is overdue, but the Chief Officer has been actively taking forward discussions with the Chief Executives of both NHS Tayside and Perth and Kinross Council in relation to that, and Gordon may want to come in at the end in that respect. In relation to action number 39, I'm pleased that that's now complete on the basis that we're going to include reports on all hosted services, including Angus and Dundee, in our performance reporting moving forward. In relation to action number 41, that is part complete. We have our strategic commissioning plan, but our action in relation to the strategic planning group remains outstanding. We've been taking on quite a lot of work to refresh the strategic planning group. You will note that that was due to take place in December. We're at the end of November now. I think that will be unlikely and is an ongoing impact of COVID response in terms of officers, but our full intention would be to bring forward that meeting in January in terms of the refreshed strategic planning group. And in relation to action number 43, the remaining outstanding action there is in relation to the treatment of reserves within budget setting, and that's ongoing, and we don't foresee any problem with getting that one resolved within our setting of our budgets for this financial year. The further outstanding action at 45 has been superseded by 58, and that's again in relation to the corporate infrastructure and the leadership arrangements, and Gordon, I'm sure, will wish to come onto that at the end. I wasn't going to pick up any other actions at this point. Gordon, would you like to mention anything in relation to corporate support and management infrastructure?
Thanks, Jane. Just firstly, for the benefit of the committee, a correction to something that Jane said. The report that's coming to the IJB, in which the IJB is seeking to receive and we're trying to accommodate, is around the mental health strategy, not specifically inpatient mental health services. In terms of corporate support, Jane's correct. I have raised this with the chief executives of both statutory partner organisations. There is potentially a need for us now to meet, as I need to provide more information on the basis of the request that we provide some additional management capacity within the Health and Social Care Partnership. Clearly, this is something that some members of this committee will be aware has been flagged up in previous audits in the joint inspection and in our annual self-assessment of governance. However, both chief executives need a bit more information in order for them to be assured of the need for us to bring in some additional capacity. So we are looking to schedule a conversation in order to progress that. That aside, there has been the opportunity for us to reflect on the capacity that's needed in order to respond to COVID, and we will be looking at what we can bring in much more quickly to ensure that we have a resilience about our response, with potentially the opportunity for that to be offset against the funding that we would seek to claim back from the Scottish Government that's specific to our COVID remobilisation plan. So there is action in respect to both of those issues, and I hope that we will arrive at a position where it's able to be supported by both chief executives in order that we can potentially recruit some additional capacity within the partnership. This probably is something that refers back to a couple of audit and performance committees previously, where we had to highlight that there were a number of areas that we hadn't made the progress that we would have liked, and I think members were saying that we needed to quite clearly identify all that we need to do, all that we have to do it, and to surface the gap that highlights, and that's essentially what I've sought to do. So there's further discussion to be had, and hopefully we will see some progress, or we will have to be much more explicit about the activities that we're not going to be able to continue to progress as a partnership.
Okay, thank you, Chief Officer. And just to say, I think that's very welcome that those discussions are ongoing. As you have highlighted, it's something that has been raised in a number of audits, and indeed the joint inspection report, but also that members of this committee and the board itself have been raising for quite some time, which would allow us to progress some of the additional work that we would like to see. So that's very welcome. Also welcome about the commitment to have reporting on all of the hosted services going forward. I think that's another gap in assurance that has been identified, and particularly we've spoken a lot about some of the hosted services that we have responsibility for, but perhaps it's too easy to forget that there are hosted services by other partnerships that deliver services for residents in Perth and Kinross. So I think that's welcome that we will be getting updates on those in the future. Can I ask members if they have any questions on this report? Ms. Kilpatrick, have you got your hand up? Sorry, I could only see half of you.
Maybe that's a good thing. Yeah, just one thing, Gordon. We talk about the well, two things really: the head of strategic planning and performance post, and presumably you're having to put a case together for that post, are you? Can you hear me, Gordon? You're on mute. You're on mute.
I think you managed to mute yourself and then remuted it. There we go.
Sorry, the icon bar on my screen keeps disappearing, so I never know if my camera's on or if my microphone's on. I trust that you're hearing me now from your response. Thank you. I've put together an S-bar, and I think quite a compelling case on the need for that additional capacity. I just need that to be the accepted views of both chief executives. Clearly, and understandably, given the level of additional investment that might be needed, there's quite a robust challenge from the chief executives in relation to that business case. So we're having those conversations, or we're hoping to schedule those conversations in order that we can explain further, or that I can explain further what is needed. So let's see how those progress. I mean, it's fair to say that obviously from their relative perspectives, they maybe have different views on how well resourced or otherwise the partnership is. So there's a need to try to provide further clarity around why this post is needed. Is probably all that I can say at this point.
Okay. And my other question was the performance framework. You said it's approved by the executive management team. Have we seen that? Has that come to this committee? And what stage is it at? And, you know, because I've raised a few things in the past about the comparability of statistics and how the performance report is presented against previous year's performance as opposed to what we would call best in class performance. So I'm quite interested in that, but it might be that it's been here before and I've commented on already. There's so many committees and meetings and papers, Gordon, it's difficult sometimes to keep track. So that's just an open-ended question. No,
I mean, I think it's a reasonable question. We've certainly provided the committee with the annual performance report, which was approved at the last meeting and then was noted by the IJB thereafter. We also have the quarterly performance report, which provides information in relation to how effectively we're performing against the number of KPIs. Fair to say that our ability to deliver on that is somewhat curtailed by the focus that we're giving to the pandemic response at the moment. But that information has certainly been made available to the committee, and we continue to have a timetable of reporting in relation to performance on an ongoing basis, which will see the committee get regular reports in relation to both the overarching performance of the partnership, but also some of the locality reports on performance that have previously also been requested.
But this isn't a new performance framework we're talking about.
So this is the performance framework that was initiated probably about a year ago in response to the
that's okay.
The joint inspection, and which we've reported on. And I mean, I have to say that we do acknowledge the potential for us to further develop it, to try to get more qualitative information in relation to people's experiences and outcomes. And our intent to do so has unfortunately been impacted by the ability to do so because of the pandemic response.
Thanks, Gordon. Thank you, Chair.
Thank you, Mr. Kilpatrick. Any further questions from members? I had one myself, Chief Officer, with two parts to it about the strategic planning group and the oversight that the Integration Joint Board has of the delivery of the strategic plan. I'm just wondering, I think we have, I'm right in saying, you can correct me if I'm wrong, that we have to have a strategic planning group. But we have a lot of discussions about this split between strategic planning, that is the responsibility of the board, and then below that operational delivery, which is the responsibility of officers to deliver on those strategic plan objectives. We have, I think, public partner representatives on that strategic planning group to give their lived experience of either being a carer or a service user, but we don't have any direct involvement of the members of the Integration Joint Board, although it's notionally a strategic planning group. So first, I'm wondering, in the refresh, has any consideration been given to, even in an observer capacity, having involvement of Integration Joint Board members in that body? And the second part of the question is, particularly given some of the discussion that we had in one of our briefing sessions about mental health services across the whole of Tayside, particularly inpatient mental health services, and obviously some of the changes that have come about following the ministerial intervention in relation to our responsibilities in that regard. Has any consideration been given to, I never want to advocate something on a Tayside-wide basis, but I think in this case it perhaps makes sense, some kind of maybe joint board committee is too formal, but bringing together the three IJBs to have oversight of the delivery, particularly of the inpatient mental health services, given that there seems to be that our specific responsibilities are no longer the same as they were previously, so that there continues to be that oversight rather than just coming to the 3 boards, but we can have that dialogue with the three different IGBs. So if you can maybe answer those 2 points, thanks.
So in response to your first question, I probably would agree that there's a need for us to reflect on the extent to which IGB members are assured on the work of the strategic planning group. We have done a bit of work within the executive management team around a proposed revised membership in terms of reference, and did have a discussion around whether or not that might include IGB members co-opted onto the strategic planning group, which is something that we could certainly explore. At the moment, we had intended that I would chair that until it is able to be reinstated, but that shouldn't preclude us from, once we've established that group, from looking at the potential for it either to be chaired by one of the non-voting IGB members from their perspective as a service user or carer representative, or potentially an IGB voting member. What we would probably need to do is both reflect on the statutory guidance around how the SPG, the Strategic Planning Group, should be constituted, but equally I would be keen to see if there are opportunities for us to reflect on and learn from examples of good practice elsewhere, because whilst it is the case in Perth and Kinross, we've had a bit of difficulty in continuing to operate and support the strategic planning group. Others are doing that far more effectively, so we should be prepared to learn from them. Your other question is not one that we've considered, but I certainly think it is worthy of consideration. Certainly at officer level, we're working very effectively, collaboratively on a pan-Tayside basis, both in terms of the operational leadership that's been given to the development of the Tayside mental health and wellbeing strategy, but also, as members may recall, at the point when David Strang's report was published, or in advance of that, the Tayside Executive Partners Group was constituted, and it comprises the 3 local authority chief executives, the Chief Executive of NHS Tayside, the Divisional Commander from Police Scotland, and the 3 Chief Officers, who are really applying some challenge and oversight and leadership to the development of the strategy, the response to David Strang's report, and the associated issues that fall from that. What we haven't done is looked at whether or not there is the potential for that sort of pan-Tayside board approach that could include representatives from each of the IGBs, and that's something that perhaps we can consider moving forward. The focus hitherto has really been about officers getting together across Tayside to support the development of the strategy, but that's not to say your point isn't worthy of further consideration, and I'd be happy to feed that into both the Tayside Executive Partners Group and to the discussions that I have on a regular basis with Kate Bell, who's leading on this work.
Okay, thank you, Chief Officer. 2 very positive responses there. I'll just finally check if there are any further questions on this report before moving on to the next one. Okay, the next report is item 4.2, which is the Internal Audit Progress Report, and I'll invite the Chief Internal Auditor to introduce this report. Thank you.
Thank you, Chair. The report is quite self-explanatory, and as it's tabled with regard to the progress with the internal audit plans. I had hoped and anticipated that assignment 2003 Commission service providers would be presented to this committee. progress this area. However, as stated in the background in the report, part of my team at Perth and Kinross Council has been retasked to support Test and Protect. I'm anticipating that this resource will return to me within the next week or so, and then we will continue with that work. But as I said, that assignment is quite well progressed already. The financial risks audit, which is outstanding from last year, I've been informed by colleagues in the NHS Internal Audit Service that I should see the draft report for that next week. So all being well, that should be available for the next meeting of the Audit Committee. The two other assignments within the plan for 2020-21 are scheduled to be undertaken in the first quarter of next year, but I'd like to draw your attention to the fact that there could be a slight delay because of the resourcing issues as a result of retasking of my team for some of this. But I would hope that it would only be a very slight delay, if any delays at all. So in conclusion, I'm asking you here just to note the progress with the delivery of the plans and also note the potential for a slight delay in the current year's plan. Thank you.
Thank you, Chief Internal Auditor. Can I first ask, before I open up to questions from other members, you've mentioned it a couple of times about the resourcing issues and have done so in the report as well. I note that obviously in terms of redeployment, that's a matter for the Chief Executive of the Council as Head of Paid Service to determine. I've had slight concerns about, particularly given the significant grant funding and other tasks that have had to have been done very quickly during this pandemic, that's something that internal audit should be having clear oversight of, which I'm sure you are. But I'm just wondering, do you feel that redeployment is appropriate, and are you able to, clearly some of these, the progress on these is not what you would like it to be, but are there examples in the IGB of similar things where, not necessarily grants, but have been going out very quickly, that you feel that you don't necessarily have the capacity to deliver on that? And if so, how are we able to address that?
I think what I would say at this point, Councillor Purvis, is that I have the oversight to see what where we are with the Internal Audit Service, and I would certainly say that from the work that has been done with the particular audit that is progressing, that there is a great deal of assurance being taken from that work already that we've been done. I don't have any massive concerns about us achieving the internal audit plan, but it just may well be that it is a little bit later than I would have hoped.
Okay, thank you. Any questions from other members on this report? No? Okay. If we move on then to item 4.3, which is the common definitions, and I'll again ask the Chief Internal Auditor to introduce this report.
Thank you. CIPFA has released the results of its research into communicating results using common definitions, and has recommended their use throughout the public sector. The definitions were accepted by Perth and Kinross Council in September, and I would hope to use these definitions included in the 2020-21 plan onwards. The benefits, as I say, to members of the Integration Joint Board's Audit and Performance Committee, and indeed for any member of any audit committee in the public sector, would be that of the consistency of application and of understanding of the definitions with differing bodies, and it also assists with sharing and with comparability and for benchmarking purposes. I'm requesting that you note the contents of CIPFA's report and setting common definitions, and also that you approve internal audit reports using those definitions going forward. Thank you.
Thank you, Chief Internal Auditor. It certainly seems a sensible suggestion to me, as I'm sure is similar with other members. It has been a bit confusing sometimes sitting on different committees or reading different papers where they don't necessarily mean the same thing in different on different boards and groups, and I think this will help bring some consistency there. Are there any questions from members on this report?
Callum?
Ronnie, sorry, could I just ask if both for Ronnie and Pat, if you could put into the chat if you wanted to speak, because I'm not always able to see you, if that's okay. But yes, Mr. Erskine.
I can do that. Thanks, thanks, Chair. I don't have a virtual hand to put up, unfortunately, I think, as a guest. I'm a SIPFA member, so I don't know if I need to declare that interest there. However, I'm not convinced that following the SIPFA guidance is necessarily right for the IJB. The Institute of Internal Audit also has guidance that we have to follow, I believe, as internal auditors. And what tends to happen across the public sector, and my understanding anyway, is that local authorities follow the SIPFA guidance, but on the health side, perhaps the Scottish Public Finance Manual is a more useful document to follow. So although in the face of it, this might seem very sensible, I just wonder what approach is taken across the IJB sector as a whole, which is a neither fish nor fowl in terms of council or health. Is there a common format across IJBs in relation to the sorts of issues raised in the SIPFA report? I think that should be our benchmark.
Chief Internal Auditor?
I'm not aware of anything separate being raised for integration joint boards. The aim of the SIPFA document is to be pan-public sector, so that it would cover all aspects of the public sector, including such as like the Canals Authority, as well as local authorities. And it is not seen as being anything which is specific for local government. As I said, I see the advantage of there being a consistency of approach for people who sit on various different public bodies. I don't know what Tayside has adopted this going forward. It is something that is relatively new, and it really is about I'm putting it forward as being a way forward so that there is a consistency there, and there's a consistency of application across across the public sector. If it's something that you're not happy with, then obviously that's a matter for the committee to decide.
Thanks. No, I wouldn't say not happy. I'm just keen that what we do is right for the IJB, and I'm conscious, or certainly aware, because I've raised the issue on the NHS Tayside. Are we on the health side going to follow this guidance? And the answer is hasn't been considered yet. That's the response. But the SIPFA guidance is perhaps not in the detail being seen as quite as helpful in the past as IIA guidance. So I guess all I'm asking here is that we just bear that in mind, and ideally what we Chair, what I would think we could do or should do if possible is ensure we have consistency across the area. Again, I know you'd mentioned the point about other IJBs. I'm not sure what they're doing, so I would just ask that if you have any discussions with your counterparts, it would be helpful to find out whether this approach has been adopted elsewhere.
I will certainly take that forward with my colleagues. Yes, I will do.
Thanks.
Okay, thank you. Are there any further questions on this report? No? Okay. Well, can I ask members then, noting the comments that Mr. Erskine has made and the undertaking by the Chief Internal Auditor to discuss with our colleagues in other IJBs and the NHS to see what they are doing. For the moment, are we happy to agree these definitions to be applied to future internal audit work, but with the caveat that if that's not the same as what's being applied across the rest of Tayside and indeed by the other bodies, then we could reconsider the matter at that stage with that information. Is that satisfactory for other members of the committee?
Yeah, happy with that, Callum.
Yep.
Okay, right, thank you, that is agreed. If we move on then to item 4.4, which is the Strategic Risk Management Update, and I'll ask the Chief Officer to introduce this report.
Thank you, Chair. I'm pleased to be able to introduce report 4.4 on the Strategic Risk Management by the Health and Social Care Partnership. The IGB Strategic Risk Profile was reported to the Audit and Performance Committee in September, and we have since done some work on redeveloping the Strategic Risk Register and taking account of the particular risks that we are managing and mitigating as a consequence of the COVID-19 pandemic. So what we've brought forward to you today are both the details of the risks that have been incorporated, as well as the timetable that we've identified that will get us to a position where we have developed these risks further, both in terms of awaiting updates from the risk owners and looking at the groups and bodies that will provide assurance and take forward the necessary action to seek to reduce the risk scores and bring forward further controls and mitigations. So that work is underway. I would also wish to draw to the committee's attention the items at 2.5 and 2.6 in this report, particularly given the questions that we've been asked earlier in the course of this committee, and that's around the work that we're doing on a pan-Tayside basis to look at our risk management policy and strategy to work collaboratively with the other IJB's Health and Social Care Partnerships, sharing our risk register and seeking to achieve a much more consistent approach across Tayside. So that work is underway, and revised policy will be brought forward in due course. Appendix 1 includes the strategic risks, and the committee will be wished to note the risk owner supporting forum and the way in which we've assigned a corporate business partner to advance the work that needs to be progressed in relation to these risks. The following appendix shows the relationship between the strategic risks, the COVID risks, and the work that we are planning to do in terms of risk mapping and risk development. And the timetable for that is included as Appendix 3. Members of the committee will be familiar with this, having previously received earlier iterations of the plans that we have in place to do the risk register redevelopment work. Important to recognise that the timescales have been pushed back because of, as we have referenced throughout this committee, the necessary prioritisation that we've had to give to our COVID response. And obviously the COVID response now includes preparation for winter, flu immunisation programme, which is well underway, and the imminent delivery of the very significant COVID vaccination programme. So like so many things at the moment, we need to be sensitive to the fact that some of these dates may be exposed to a degree of slippage because of the prioritisation that we're having to give, understandably, hopefully, to the committee's perspective, to COVID response and a range of activities that are demanded from that in order that we can mitigate the impact. I'm not going to go through in detail the various risks. I'm happy to take any questions. Express gratitude to colleagues in corporate services who've very much been the driving force behind this work. So I may even bring in colleagues from corporate services to support any answers to any questions as necessary. Thank you, Chair.
Okay, thank you, Chief Officer. And just to say, I think this is very welcome, following on from discussions at previous audit and performance committees. You know, while we all appreciate the pressures that everyone in the team is under, and that of course you are continuing to monitor risk, it's still incumbent on us as an audit and performance committee to have oversight of that. And I think pulling the existing strategic risks and the COVID-19 risks together, at least into a high-level document at the moment, is the right approach. But with that, I'll ask if there are any questions on the report or the appendices. Mr. Erskine.
Thank you. Thanks, Callum, and thanks, Gordon, for that. Strategic risk management is something that's quite close to my heart, and when done well, I think can make a really big difference actually to an organisation's effectiveness. So what I like about the risks in our document is they're clear and they're quite short, and they actually do set out what the risk is. It's not 10 risks combined into one statement. So I think that is evidence of some good thinking. I think that's gone into the preparation of it. What I wondered about, and I know it's still under development, I've got 2 or 3 questions here. I'm assuming that when we get to the stage of finalising a register, it will have risk scoring contained within it in relation to gross risk and residual risk after, you know, control actions are in place. I'm assuming that will be the case, and Gordon will be aware certainly that there's quite a lot of work been going on in the last 6 months or so within NHS Tayside on revamping the whole process for the management of risk. I would imagine the IGB group is looking at that to help inform what would work for Perth and Kinross alongside Perth and Kinross Council risk. So that work is out there. But the questions I've got, I guess, how are we planning to go about aligning or ensuring some kind of read across of strategic risk between the IJB and our partner bodies? You know, I know the risks may be separate, but there may also be some degree of commonality there as well. So I'm interested to understand what the process is likely to be for that broader risk discussion. And also a more of a naive question, given my not terribly long time in the organisation, what is the intention for the discussion of strategic risk at the board level? I know we've got a role here at Audit and Performance, but is the expectation we'll have perhaps an annual discussion at board once we get to the right point in time that something has been pulled together? A final question, third question. I didn't see a risk in there around the knock-on effect of the focus we have on the work on the pandemic at the moment, on elective and other care, you know, the risk of some of that not happening. Is that contained within one of the risks that's what's in the appendix, or is that something that we need to consider including at a future date? Well, a few questions in there.
Yeah, thanks.
Officer.
So firstly, just to say that we do have a document that provides a lot more detail in relation to the scores, the controls, the mitigation, the actions. We just haven't brought that forward today, and it's really what we need to provide a refresh of to make sure that it is contemporary. And we require considerable work to be done by our operational management colleagues in this regard, and again that is one of the risks that they are busy focusing on other activities. In terms of the broader risk discussion, I suppose it's important to reflect the fact that every month we take a report on our risks within Perth and Kinross Health and Social Care Partnership IGB to NHS Tayside's Strategic Risk Management Group. Our model has very much been based on the Council's approach, and indeed the NHS Strategic Risk Management Group have been very receptive to the extent that they're considering how they might adopt a similar approach across the 3 IGBs and within the NHS board. So we certainly have that level of engagement. We also have the connections through the Council's Strategic Risk Register and both of which potentially can either be reported to the NHS board or the council's scrutiny committee. If we need to do that and then report to the IGB, then once again we'll be challenged about the levels of duplication that exist and whether or not we should be achieving a much more moderated and proportionate response in the integrated world that we're seeking to occupy. But that is presenting a challenge, because obviously the statutory partners are very keen that we report to both of them and to the IGB. So we do spend considerable time preparing reports and reporting to various groups and bodies. I don't think we've got a risk around electives or outpatients, principally because those are presumably included in the context of the NHS board strategic risk register. They are considerations that are made by colleagues in the NHS in relation to whether or not they should continue. And I mean, at the moment, it's fair to say that there doesn't appear to have been any scaling back in relation to the levels of activity that are underway, unlike what we perhaps saw in the early months of the pandemic. Very many NHS services, non-COVID health services, have been able to be remobilised and are continuing to operate at a high level. I think the risk for the partnership is that whilst that happens, our ability to release staff from the services that were previously scaled back is severely limited, and that potentially has an implication for our ability to build that resilience and preparedness into our staffing response to the pandemic. So there's a number of issues there that we're regularly in discussion with colleagues across the NHS in respect of, and that's really characterised by the Scottish Government's strategic framework around COVID, and that's the balance that needs to be struck between COVID health risks, non-COVID health risks, social risks and economic risks. So electives and outpatient activity continue to be delivered to a fairly high degree. I don't have the particular details, but I know that there's an ambition within NHS Tayside to continue to ensure that people are able to access other health services and treatments beyond merely the COVID response. So there's probably a lot in that response, Ronnie. I'm not sure that it necessarily will satisfy all your questions. I see Jane's put her camera on, which is always an encouraging sign. She may be able to provide further information if there's anything specifically that you would want to draw out a bit further there.
Thanks, Chief Officer. I'll bring the Chief Financial Officer in a moment. I think it would be useful. I know that Mr. Erskine raised about the making sure that we have risk registers across NHS Tayside, the Perth and Kinross Council, the other councils and the IGBs, where there's a link up between them. And while, yes, it's not our responsibility, some of these particular services, it would be prudent and helpful to see what the impact that one service has on the other. How you would best present that, I'll leave that with you to come up with, but I think that might be helpful. And just also to raise to Mr. Erskine, the last time we had the full strategic risk register to the Audit and Performance Committee was on the 17th of February. Clearly that was before the pandemic and before the COVID-19 risks were introduced, but that was item 4.2, so maybe you might want to go and have a look at that one to see when we get the full register developed. I would assume that it will probably look something similar to that, with the inherent and residual risk scores in it that you referenced. But I'll bring in the Chief Financial Officer and then come back to you if you want to come back in.
Thank you, Chair. Yeah, I just wanted to pick up a couple of things. Indeed, Councillor Purvis, you've just noted that the standard reporting of our risks will absolutely include the gross scoring and then the scoring after the controls that we have in place. So that will absolutely be part of what we bring forward to the committee in February. I mean, I guess it's worth mentioning that strategic risk management during a pandemic is something that's, you know, quite a unique challenge for us all, and why our close working with the Tayside-wide group has been enormously helpful. And that group, which actually includes council colleagues as well as NHS colleagues, will be a really strong kind of reference group for us moving forward. And I guess it does link to the challenge around a separate COVID risk, and we have taken the decision not to pull that out separately. We, as Gordon has indicated, we would see that as being managed through the risks, individual risks that we set out, workforce risk, and what the challenges will be to workforce moving forward, finance risk, what the challenges may be in relation to additional costs and what that means in terms of managing our financial position, capacity and flow, and ensuring that there is no impact on that from COVID, and indeed digital. We've come to rely so much in many regards in terms of the digital services, in terms of both as officers, but also in terms of frontline services, so ensuring that risk is managed. So we've taken the decision in consultation with Tayside-wide colleagues to not see COVID as a singular separate risk, but look to manage it through those individual risk areas, because we believe that it's going to be with us for some time to come, and that's the most robust way of approaching it. And I agreed entirely with Ronnie that strong risk management, which is where we're headed. I'm delighted with these comments around how we've described our risks. Really, grasping this and making it part of our core business is what we absolutely intend to do, and we'd hope that what we bring forward in February will give further assurance of that commitment.
Thank you, Chief Financial Officer. Mr. Erskine, did you want to come back in on any of the points that had been made?
I did, Callum, thank you. Just welcome to hear those, and it's certainly a paper I can go back and look at in February. That's a good option. I agree with Jane's comments in relation to not having a separate risk for COVID, which is the easiest thing to do. It's the impact on the other areas of what we do that are important, and we've articulated that well, I think, in the document. I suppose the one thing, going back to Gordon's comments about reporting on risk in too many places in too many different ways, almost gets me back to the conversation in January around differentiating between the role of the IJB and the constituent or the other bodies that we link into. Because in terms of strategic risk, I think that is absolutely something that is owned by the board. So I can't see how there can't be a conversation, or really either that can be entirely delegated to audit and performance. Through the year, I have no issue with audit and performance at every meeting in a normal world, receiving reports and scrutinising risk. But I do think the board of the IJB needs to at least once a year have some oversight and discussion on those risks, and I would ask that we do, once we get to the place that we feel this is sufficiently well developed, at some point in the first half of 2021, that we bring something back to the board for their input and ideas and blue sky thinking, if nothing else. Thanks.
Thanks. I think that's certainly a discussion that we can have with the chair of the IGB, perhaps using a similar format to some of the improvement plan or something else, where an annual report would come to agree, in this case, the inherent risk scores perhaps, and then we monitor the residual ones throughout the year and report back. So we can certainly look at that. Okay, can I ask if there are any further questions on this paper or comments? Okay, well, we have under the recommendations to note the progress in relation to the risk register, note the planned and ongoing work in developing the full register, and also then to request that the fully developed IGB strategic risk register is brought back to the next committee, which is on the 15th of February. So I'm assuming we're all happy with that. Okay, just before we move on to the next item, to welcome Sandra Auld. I think she's been having some technical difficulties, as we all were at the start of the committee, so welcome to her. The next item is item 4.5, which is the Joint Inspection Plan update, and I'll ask the Chief Officer to introduce this report.
Thank you, Chair. So this is a supplementary paper, so apologies firstly that this came out slightly later than the substantive papers for today's committee. Essentially what we've got here is an update report for the benefit of the Audit and Performance Committee in relation to those areas where we have been able to make progress in response to the recommendations from the joint inspection that was carried out by the Care Inspectorate and Healthcare Improvement Scotland. But equally, we've identified some areas where, for the reasons that we've rehearsed previously, perhaps we haven't made the progress that we would have liked. Just to remind members that the joint inspection was carried out up until around about March 2019 and took into account the work of the partnership over the 2 preceding years. There was a slight delay in the publication of the inspection report, which we received in September 2019. The report was fairly critical of a number of areas of our activity within the Health and Social Care Partnership, and obviously we have taken very seriously our responsibility for improving where we can and addressing the shortcomings that were identified in the course of that inspection. I suppose it's also fair to say that from the period when the inspection was underway until the report was published, we had already identified a number of areas where improvements were needed and had put those into train. I think also I would wish to remind the committee that the focus of the inspection was around how well we plan and commission services to achieve better outcomes. So this was about the extent to which we had in place the infrastructure and the building blocks, culture and leadership to deliver on strategic planning, commissioning, performance improvement across the health and social care services that the Health and Social Care Partnership are responsible for. That's quite different from the reports that we've produced elsewhere that show that our performance in relation to national outcomes and indicators continues to be above average and continues to improve in many cases year on year. That said, the appendix to this report provides the detail in relation to the progress that we have made in response to the joint inspection. And particularly areas of note at point 3 in the report are around our approach to improvement in performance monitoring. We have benefited in some ways from the need to ensure that we take swift action in response to COVID. So that's led us to be able to more effectively deliver on strategic planning and have that agility around our decision making and our remobilisation activity. And as it has been indicated previously, we've also brought forward proposals around the strategic planning group and how it might function more effectively. And we'll be presenting to the IGB next month more detail in that regard. There are a number of areas where we haven't made the progress that we would have liked. And again, those are identified in section 3. I probably wouldn't wish to say much more than that, Chair, because I know that there will be particular areas from within the appendix to this report on which members of the committee may wish to ask specific questions. So I'll just stop there and invite any questions, which again I might invite colleagues to support me in responding to if I feel that they are better able to do so. So thank you very much.
Okay, thank you, Chief Officer, for that. Can I ask members if there are any questions on the report or the appendix? Mr. Kilpatrick?
It was on the issue of commissioning, Gordon, and it's really more a question of it's a kind of opinion, really, and I'm asking for your opinion. And really, do we think that we really pushed the boundaries of commissioning around the provision of services from the third sector? Is that now kind of clearly embedded in the commissioning plans that, you know, that we reckon. It's just when you read a lot of health and social care documentation, it doesn't really look as if we are actively commissioning third sector provision, but maybe that's not the case anymore. Maybe we are commissioning it more specifically. But I felt the last time I think I looked at the commissioning plans that was a question I had, was, you know, especially around things like mental health services and learning disabilities, where we know that charities and voluntary organisations have got really some very specific skills which are hard to replicate in the public sector. So it's really an opinion, really. Do we think we're pushing the boundaries there? Do we think we could do more? Do we think it's forward-looking enough? Do we think it exploits and explores their strengths in the way that we need to?
Chief Officer.
Thank you, Pat, and thank you, Chair. I mean, I think whether we can do more is a comparative, relative reflection. I think it's probably worth just reiterating our baseline provision is that we are spending hundreds of thousands, millions of pounds each year procuring, tendering, commissioning, monitoring and redesigning in partnership with the third and independent sector a range of services, and this is probably an established position that predates integration, that where local authority, social work departments would have contracted and commissioned. You know, from our perspective, 30 independent sector, 39, 40 independent sector care homes in Perth and Kinross, from whom we purchase beds. We've got large numbers of third sector organisations who are consistently involved in fairly innovative and pioneering work, who are supporting us to put in place more appropriate arrangements for people with learning disabilities or autism, or who have behavioural support needs, who are currently in hospital or who have previously been in hospital and now are supported effectively in the community. We have contracts with large numbers of third sector organisations who are providing early intervention and preventative services across a whole range of care groups. And we are looking at, I suppose, important probably to reflect, and it may well be just useful to remind members of the committee the additional investment that we've put into alcohol services, mental health services, and third sector support through COVID remobilisation. So we've been particularly keen to respond to the challenges that the pandemic is bringing, both in terms of the impact it's having on our citizens, but also in supporting organisations who we have long-standing relationships with, who have themselves had to think about how they remobilise and how they provide services in a different way. So I think we've done a significant amount of work. We are continually reviewing that. We have a team of contracts and commissioning officers. We have a service manager for contracts and commissioning. And we need to reflect both on the extent to which COVID changes our relationship and the way that we need to invest and work with organisations to enable them to continue to deliver services on our behalf. But you're absolutely right. What can we do to ensure that we've got greater traction and pace in relation to some of the long-standing plans that have not yet come to fruition? So, I mean, that verbal reassurance, that verbal account's probably designed to try to give you a level of reassurance. It probably isn't as cohesive as you need or coherent as you need in terms of the range of services that we're providing, but it might be useful that I could provide some information offline and out with the committee to members of the committee on the scale of the commissioning activity, both financially, but both also in terms of the impact it's having in supporting the citizens of Perth and Kinross to have better lives and more homely environments, supported to have a greater degree of choice and control about the care that they're receiving.
Thanks, Gordon. Thank you for that. I mean, I do feel more reassured. I suppose maybe it might be helpful, I think, for the committee to, as you say, see some of the background figures on that. So I don't know, without making another, giving you another task. I'm sure you're very busy just now, so I don't know what the chair feels about that.
No, I agree with you, Mrs. Kilpatrick. It's something that has been discussed before, but perhaps again is an area where there's a gap in assurance that would be useful. So if perhaps the Chief Officer could take that back, appreciate again the strains that the team are under. So it's maybe not necessarily for the next committee, but at some point in the future it would be useful to have a paper on that.
Yeah, we can certainly do that. As I say, we've got a team of people who are working on these types of activities, so we can quite easily produce some reports, and we'll aim to do that for probably the committee after next.
Thanks, Gordon.
Thank you. Mr. Erskine?
Thank you. Thanks, Cal. I just had a fairly brief question. It was on the last page of the document, Gordon, and it was about the additional fixed-term service manager role. Just in the final paragraph there in the update, it mentions at the end quite a wide range of disparate sort of services within there. So quite a few gaps, I guess, have been identified. And yet the role is a one-year fixed-term role. I wondered if you could say something about why it's not a permanent role there. And do you think that someone can actually fulfil the remit? It looks quite broad. Thanks. So
this is around us making a stopgap arrangement and bringing in some additional capacity to support the activity that's already underway. It is not going to be adequate to deliver on all those range of activities to the extent that we would have liked. I would have preferred that I had the wholehearted support of both chief executives in order to bring forward the actions that I proposed in relation to the appointment of a head of strategic planning and commissioning. So this is really an interim measure that will enable those discussions that I referenced earlier to take place and to build in that capacity. I suppose it's also fair to say that aspects of these activities are to a greater or lesser extent being progressed by other people. But what we need is that dedicated resource in order that either other people can be relieved of that responsibility to focus on their main areas of responsibility, or to ensure that we're bolstering our collective efforts across a number of areas. Jane would probably, I see she's put a camera on, which is probably because this is an area that she's been working very hard on, and she'll be able to probably supplement what I've said in terms of our ambition for this post. Thank you.
Thanks, Gordon. I don't want to say an awful lot more, very much in line with what you've said. I mean, in an ideal world, we absolutely would be looking at a permanent post. Recruiting to a fixed term post is not an ideal scenario in terms of recruiting the best person and then retaining them. So absolutely accept that there's a risk that comes from that, but for the reasons that Gordon's outlined, in terms of fairness to wider staff group, while Gordon is bringing in a new structure that may or may not have impact on other members of staff, in terms of fairness to other members of staff, it wouldn't actually be fair to be recruiting permanently at the moment. So that's the other thing. But again, you're absolutely right, Ronnie, in terms of the scope of what needs to be covered. There is a lot, but some of these things are being covered to an extent at the moment. We just need an injection of capacity that will allow a review of the current team and a respread of where those gaps are, to give some real focus to areas where we're for example, IGB support, induction, member development, these are areas for years we've known that we've not been able to do well and do properly. We know there's best practice out there, but we have, month on month, year on year, not had the capacity to reach out and bring that best practice in. And we need enough capacity to allow some space to be freed up for one of us to go out and bring that learning back and to support members in the way that you deserve. So that's one big area that we really need to do better at, and will be the first focus. When we bring the new capacity in, one of the first focus will be on IGB member support and speaking to you all about what that looks like. So that's it. In terms of our priorities, that's very much at the top of the list. But linking with you all to understand how we need to do that, and reaching out for the best practice that exists in the rest of Scotland in relation to our support to members and their development.
Thank you. Did you want to come back in?
Yes, Callum, just to briefly, I just recall my first engagement. I think that most of us were at back in January, and hearing discussions about capacity and particularly around strategic support back in January. And obviously this may be a conversation that's been ongoing for some time. So certainly something we need to identify and resolve. I guess my follow-on reflection, not another question really, is there, or are there models of best practice out there for structures that we can look at and use to help inform what would work best for us? Or maybe it's not a question, I'm just saying we should look at that as we reflect and develop our own structures, and I'll leave it at that. Thanks.
Okay, thank you. Right, I'll ask if there are any further questions on this report. No? Okay. Well, if we're happy to note its contents then. If we move on to the final section of this agenda then, final item on this section of the agenda is 4.6, which is the extension of the external audit appointment. I think it's fairly self-explanatory for members. Unless anyone has any questions, I'm just going to ask if we're happy to note that.
Yep, happy to note. Great,
thank you. Right, well, if we move on now to the next section, which is performance, and the next item is item 5.1, which is the 2020-2021 financial position. Just given the technical issues at the start, and I appreciate that some people are pressed for time, I would say that there will obviously also be a financial position update to the IGB next week as well. But I'll hand over to the Chief Financial Officer just on that. Thank you.
Thank you, Chair. I'm pleased to bring forward to the Audit Performance Committee the year-end forecast based on the 6 months to the 30th of September. I would note from the outset that the report, as in the previous finance report to the board, is split into two very distinct sections: the core position, the core forecast, and the COVID forecast position. It's worth noting that we understand that the finance report, because of that, is complex for the reader, and that we note that well, we would ask the committee to note that we are trying to meet the requirements of the Scottish Government in terms of financial reporting and the need to keep separate reporting in terms of COVID costs. And the guidance that's coming from Scottish Government is changing all the time, and it means that the way in which we're reporting to committee is changing, and we're very conscious that that means a complex landscape for our members in trying to understand the position. The other thing I think I would want to say before just talking about the forecast is in relation to, in terms of our core position, the underlying, underspends and overspends. Many of those, there's a kind of unintended impact of COVID, and whilst they're reported separately from direct COVID expenditure, there's undoubtedly a COVID related impact in terms of our ongoing focus on COVID response and remobilisation. So the financial performance report that we're providing in many ways is not reflective of any kind of underlying financial performance, and I know that that makes it difficult for members as they seek to bring challenge and seek to gain assurance. And it's just to recognise that at the outset that we're in a very extraordinary position in terms of our finance reporting as well as our other reporting in relation to the impact of COVID. But that said, we will do our very, very best to make this as cohesive and comprehensive and as easy to understand as it's possible to be, and we will continue to work on that. In relation to, just very briefly, and members will have had a chance to read the report, so I'm not planning to spend too long on it, but in relation to our core position, we are reporting a net forecast underspend of 1.2 million. You can see that that's broadly split into a small underspend on health. The reason that that's small is because we're offsetting an underlying deficit that was approved by the IJB, and our significant underspends are largely offsetting that. And we've got £1 million underspend on the core position within social care that's largely driven by underspends in care at home and adult support services. So we have got a significant underspend on our core position. And as I said at the start, that's not a direct impact of COVID, but it's significant reasons behind some of these underspends are the unintended consequences of COVID and the focus of our management teams on delivery of response and remobilisation. In relation to COVID, we are forecasting significant costs, 7.2 million, the largest part of which relates to provider sustainability payments and unachieved savings, payments to GPs and additional staffing costs. Against that forecast, to date, the Scottish Government have confirmed income of 4.87 million, and in theory, what's set out in the report is a net gap of 1.947 million. However, I'm pleased that we're able to report the Scottish Government have confirmed further allocations that will come forward between November and the end of January that will fully offset that gap currently reported in the report before you today, and that we fully expect that, that COVID expenditure will be covered in full by the Scottish Government. So whilst the situation is complicated due to COVID, the IJB's financial position, interestingly, is relatively positive for the year end, in that we look as though we will be close to a break-even position once Scottish Government additional allocations have been formally confirmed. And I'm happy to take further questions.
Thank you very much for that, Chief Financial Officer. I'll ask then if there are any questions from members. Mr. Erskine.
Thank you, Callum, and thanks, Jane, for that overview. I would certainly agree with that sentiment, and it looks like the most important message for us is a positive one, and that we don't have any serious concerns in relation to our projected year-end position at the moment, despite the complications, although 4 months is a long time, as they say. So the questions I guess I've got two general questions. First one quite easy to answer, I suspect, and the second one maybe a bit trickier. And the first one is around an assurance to this committee that the guidance that you talk about in relation to COVID and the way that that impacts on the way that we record our spend and our savings as either, you know, core or as part of the COVID reporting to the Scottish Government. I'm really just looking for an assurance that we're absolutely confident that what we're doing and what we are recording there is in line with what we are being asked to do. So I think that should be hopefully a simple one to answer. My second question, though, is more around some of the variations that we see, some over and underspends, and what the impact of those is in relation to service provision. For example, the delay in the implementation of packages that we have, I think, in 432 on people. I always think it's a good thing if we can to integrate financial performance with service delivery. You know, underspends often result in reduction in service delivery, and overspend can actually be a good thing, even if it's not financially a good thing. So I guess my question is, do we feel we can say something about the impact of the numbers on the quality of service provision? Do we think there is any possibility of providing some enhancements to the report in future that might link service performance a bit more explicitly to financial performance? I've got some more specific questions, but I'm just going to leave them given time. It's these two broad questions that are the main things for me. Thanks, Chair.
Thank you. Chief Financial Officer.
Yes, first of all, Ronnie, your question around assurance or compliance with the guidance. What I would say is, because that guidance is changing almost week on week, the report before you today complies with the guidance at a point in time, and that when you next see this report, you may very well see that it's the way in which we report changes again. For example, the way in which savings, under delivery of savings is treated, that is, that is likely to change again. But you'll understand that, reports have to come forward quite a few weeks before we actually have committee, and therefore I'm aware of changes already that we're going to have to make to the way in which this is presented. So we'll do our very best to be as up to date as we can, but there is a bit of a timing gap. So we're committed to doing that, and we'll do our best to keep it in line with guidance. In terms of overs and unders, I mean, Gordon will want to comment on the impact of underspend on the quality of service provision. But the interesting issue for us, and I welcome any comments today, is that we also present to the Audit and Performance Committee today a performance report that sits alongside our finance report. And the finance report, because it comes forward regularly and is comprehensive, it does become the focus for questions about wider performance issues. That in some ways it puts quite a lot of just choosing my words carefully, focus on answering all of the questions within that report. I'm not sure that's how we should be approaching this. I think we should have a finance report and a wider performance report that sit hand in hand, and that there's a link between the two. I'm not sure if we're there yet. I think when we look at the performance report as the next or the second next item on the agenda, I'm not sure those linkages are there. And one of the reasons for that, I think, is that we are in the middle of an emergency response. Our service teams, heads of service, are very much focused on that, and they're the time that they have to spend on making sure that we are able to do that as transparently as we would like. I think we would have to acknowledge we're not there yet with that, in part because of the emergency response that we're in. But I would challenge that the finance report and the performance report need to sit alongside each other and link together, and that's where our improvement needs to come in the months to come. But I would probably very much hand over to Gordon in terms of the key areas of underspend and any impact on quality. It's unfortunate I don't think either Evelyn or Diane have been able to be with us today. Gordon, do you want to pick that up?
Thanks, Jane. Yeah, I mean, I think it's very difficult to make any sort of determination about the quality, the impact on the quality of what we've been providing. The underspends that we have are because we haven't been able to advance some of the plans that we would have liked to have advanced. In adult services, we've got ambitious plans to provide new models of support to enable people who are in long stay hospital or in out of area placements to return and to be supported in their own community in more homely settings. Unfortunately, but perhaps inevitably, that has become subordinate to our immediate response to the global pandemic and a focus on maintaining critical services to protect people from the greatest harm. Other examples, though, are that what we've seen is the mobilisation of family support and carers who have relieved us of the need to provide care at home services to a number of people, principally because people were themselves as carers in lockdown and were more available to provide the support that we would otherwise have been providing through our care at home services, and or because they had a heightened degree of anxiety about various people coming into their loved ones' homes during certainly the very early months of the pandemic. I think it's also important to reflect that some of our plans will need to be seen through the lens of COVID. You know, is group living a model that we want to support for people with learning disabilities, or does that introduce too many risks in terms of infectivity, cross-infection, infection prevention and control? So there's a number of areas where we haven't made the progress that we would have liked, where we haven't had to provide the care that we might otherwise have been providing, and where we have had to focus our delivery at the most extreme and critical areas of need, given the focus has been more about at times saving lives than necessarily enhancing lives to the extent that in other times we might aspire to do. So it's been a very, very challenging 7 months, and it continues to be to a significant degree in terms of the capacity and resilience of colleagues across the Health and Social Care Partnership and within the executive management team. We have done a remarkable job in those most telling circumstances, and I continue to be enormously proud of the endeavours of staff who need to be recognised and thanked for that, including on my return today from leave to have shared with me really positive comments from care home providers about how Perth and Kinross's support to the care home sector has been exemplary, and they have been pleased to tell a national audience that we have been working so well with them. So, I mean, I really do digress, but that's probably out of a recognition of how challenging it has been and continues to be, and really just a plea that in that context we have a degree of understanding and forbearance, if not acknowledgement from committee members, that there are certainly any number of things that we haven't done either to the extent or perhaps even to the standard that we might otherwise have done had we not been fighting the pandemic.
Thank you. Mr. Erskine, did you want to come back in, or are you happy with that?
Only, Chair, briefly to say I wasn't really suggesting there would be any issues with quality. It was more about the link of finance to performance, that I'm pleased to see that we're working on that and looking to develop that further. So quite happy with that. Thank you.
Okay, thank you. Can I just briefly check if there are any further questions on this report? Okay, we're happy to note its contents then. Thank you. We move on then to item 5.2, which is the Care and Professional Governance Forum Annual Report for 2019-20 by the Associate Medical Director and the Chief Social Work Officer. I see the Chief Social Work Officer has joined us, so I'm assuming that she will be speaking to this report. Thanks.
Thank you very much, Chair. Can you hear me okay?
I can.
Yeah, that's fine. Thanks very much. This report provides an overview of the activity of the Care and Professional Governance Forum for the financial year 2019-20. So that takes us up to the end of March 2020, just at the point that COVID hit. I suppose it's important in this introduction to assure the committee that the forum has continued to meet 2 monthly throughout COVID, and the reporting schedule to date has been met by all contributors. So you're asked to note the activity of the forum and the assurances provided to it on a wide range of activity over that year. We met on 6 occasions over the year, with each meeting with a very full agenda. It's jointly chaired by myself and the clinical director, either singly or jointly. So we play to our strengths in many respects. and we're supported by the Clinical Governance and Risk Coordinator. The annual reporting on all services across the Health and Social Care Partnership were embedded in that last year, ensuring that the locality structure and the integrated approach to service delivery was taken into account, and each of the 3 localities reported within that year and are now into their second year and second cycle of that reporting. Other hosted services and other services that are not managed in localities have also reported, and you'll see from the report that we receive exception reporting every 8 weeks across the 6 domains in terms of care and clinical governance. The 15 steps, which was commenced in 2019-20, was a new venture for us, and that obviously is on hold and more restricted because of the restrictions as a result of COVID-19. You'll see also in this report results of external inspection from the Mental Welfare Commission, Healthcare Improvement Scotland and the Care Inspectorate in terms of quality of care, staffing and management, and happy to take any questions that you might have on this report. Thank you. Bearing in mind that this is now some time ago.
Okay, thank you very much. Can I ask members if they have any questions on this report? No, I'm not seeing anyone indicate. Seems you got off a bit lightly there. Okay.
Thank you.
Well, thank you very much, and thank you for that report. It's very comprehensive, and it is good to have an overview of some of the things, but as you say, a little while ago now, but thank you very much for that.
Thank you.
Okay, thanks. If we move on, therefore, then to item 5.3, which is the performance report for 6 months to the 30th of September 2020. I'll ask the Chief Officer to introduce this report.
Thank you, Chair. So, as you've described, this is 2 quarters report, so for the 6 months up until the 30th of September. This I should have pointed out when I was answering a question from Patrick earlier, that we have produced this report for the 2 quarters. This is really based on our quarterly performance review, which we intend builds up towards the production of our annual performance report, which the committee saw at its last meeting. So this reflects progress across a number of areas in relation to our performance for that 6-month period. I don't propose to go through the report, hoping that colleagues will have had the opportunity to look at it. It includes an incorporation of our COVID-19 response and remobilisation. Many of the actions that we've been taking have inevitably, and as described, been around responding to the pandemic, but it has been encouraging and reassuring to reflect that many of those actions are also very closely aligned to the strategic commissioning priorities that are incorporated in our strategic plan, insofar as they talk about the best use of resources around strengthening communities, around person-centred care, around addressing health inequalities. We have reviewed our performance in the context of the national indicators and the MSG indicators, but what we've sought to do in this report is perhaps be a bit data light and a bit narrative heavy. We've sought to include more detail by way of narrative of the progress that we've made across a number of areas linked to those strategic objectives, either in the context of our COVID response or more generally in terms of the activities that are included in our strategic commissioning plan. It may well be the case that we'll hear a bit more about this from Lindsay Bailey in terms of the detail from her locality, which is the next item I think on this agenda. But in terms of this performance report, I am again indebted to colleagues who've been doing the work on this behind the scenes, who've pulled this together, and again, who I might rely on to come in and support any questions that the committee may wish to ask about the specifics. So I'll stop there and open it up to any questions if people have them.
Okay, thank you very much, Chief Officer. I'll ask if any members of the committee have questions on this performance report. Mr. Erskine.
Thanks, Chair, and thanks, Gordon. I had quite a few things actually that jumped out, but firstly, I like the qualitative information, Gordon. I think it's helpful. And your brief introduction to the paper is also helpful. So there's a lot of really good information in there for us to get our teeth into, which I find really useful in discharging my own role. I have got a few kind of specific questions which are scattered through the paper, which if I just go through these one by one, and you can decide how you want to pick these up as best you can. First off, on the PDF, it's page 95 and 96, which is 4 and 5 of the paper itself. There's a couple of recruitment issues in there. I wondered if you could see how we were progressing in relation to the recruitment of, I think it's 4 advanced nurse practitioners and also 16 staff to cover the winter period. That was my first question. Secondly, on page 99, which is page 8 of the paper, you mention a group near the bottom of the page, 25th of May, we've set up a clinical care professional oversight group. I wondered if you could give us a quick update on how that has been progressing. Page 104, which is page 13 of the paper. There's a section there on mental health and wellbeing, and I wondered if you could maybe let me know what data we actually have in relation to the incidence of mental health issues across the Perth and Kinross area. Are we seeing any patterns there, or any particular concerns? Have we got? Are we satisfied that we've got good source data on that allow us to address any concerns? And I think that's it. These are the main ones. Thank you.
Thank you. Chief Officer, if you want to decide how you're going to deal with those.
Thank you. So I'll probably invite Lindsay to come in an item earlier. I hope she's listening, particularly in Evelyn Devine's absence. Lindsay is an able deputy for Evelyn on so many occasions, and may well be better placed to provide an update in relation to the query that you've raised, Ronnie, about recruitment in terms of advanced nurse practitioners, and also in response to the winter pressures. I'll then pick up the other questions, but Lindsay, would that be okay? Hoping that you'll have a bit more up-to-date information on progress there.
Okay, certainly, Gordon. With regard to the advanced nurse practitioners, we have been successful now in recruiting to all 4 posts. A&P recruitment in general across Scotland, because they're quite new roles, there are a limited number, but we have been successful. Many of these are trainee A&Ps, however, they will very quickly become our advanced nurse practitioners. So that's a really welcome addition to the teams. With regard to the other 14 vacancies, because I'm not quite sure in the paper where they actually are for, but most of the winter planning work we started commencing on recruitment to the care home posts. We've started recruitment to the extra post to provide 7-day working, etc. But some of it is tricky. We have a shortage of occupational therapists, for example, nationally, which poses a challenge, but most of the recruitment is out, and some are recruited too, but we're continuing to recruit to the rest.
Thanks, Lindsay. Maybe I could take the question around clinical oversight groups. So this is a care home oversight group that was established at the request initially of the Scottish Government on a Tayside-wide basis, and that is because additional powers were given to the Director of Nursing and NHS Board to oversee the work pan Tayside as we carry out assurance visits and provide support to care homes in relation to staffing or PPE or outbreak management or training in relation to infection prevention and control. Now, prior to that being initiated on a Tayside-wide basis, we had already set up very regular meetings with our care home providers across Perth and Kinross, weekly Zoom calls with input from public health specialists, and opportunities to share good practice and to provide the most up-to-date guidance to the care providers across Perth and Kinross. At that point, we had daily safety huddles where we would colleagues would be meeting to consider which of the care homes were causing the greatest concerns on the basis of a red, amber, green rating that we manage dynamically and in real time in relation to the 39 independent sector care homes and the 2 public council provided care homes across Perth and Kinross. We then carried out a number of assurance visits that we completed probably about 6 or 8 weeks ago, and we're now looking at how we can initiate a further round of assurance visits, given some of the changes that have happened both in relation to the arrangements that are now in place for people to be able to visit care homes under particular conditions, and also the ambitious programme that has been underway for several weeks or indeed months now, which involves all care home staff being put forward for testing every week in order to identify whether or not there are any risks of outbreaks. So we have a very, very robust process in play, and we continue to engage very effectively in a collaborative and improvement focused way with the care home providers in Perth and Kinross, and we have daily monitoring reports that are considered by myself, by Jackie as the Chief Social Work Officer, and are then reported into the Tayside-wide group in order that they can have a degree of oversight and assurance of the work that's underway. So I think there's a significant amount of work there, but rightly so, given the levels of vulnerability that we know can exist in the care home setting. So anything you want to ask in relation to that, Ronnie, before I move on to your next point? No, I'm going to have to ask you to refer to which section of the report, or remind me which section of the report you were referring to at the point when you were asking the question about mental health and wellbeing issues.
Thanks, Gordon. It was a section that really raised an issue in my mind, really, but it was the page 13, the mental health and wellbeing section in the paper. I hadn't realised you'd been off on leave, so it's very unfair to spring 100 pages of papers on you within an hour of returning. But
no, you're okay. I had read them before they were submitted to committee, so I should be more familiar with them. But the position with regard to mental health, I mean, I think your challenge is very valid. I don't think that we could confidently report that we have very well developed metrics that would enable us to gauge particularly the impact of the pandemic. I think it's probably the case that we are more working intuitively and on the basis of our experience and us anticipating that the arrangements for the delivery of these services will have been impacted by the pandemic. but as will people's experience of their own emotional health and well-being. So what we might have is some people who were already connected with services who are perhaps becoming or have become more anxious and depressed and disconnected because of lockdown, etc. So those are people who we are already engaging with and will be maintaining contact with, because mental health services have continued throughout the pandemic, albeit delivered in a different way. Important also, though, to recognise that there will probably be a number of people whose emotional health and well-being will be adversely affected, who might otherwise not have experienced that and might otherwise not have required to reach out for support or to be referred into services. That's really where we've done that work with the support, additional funding that we've given to 7 third sector organisations across Perth and Kinross, in order, and this was the challenge that we put to them, that they could continue to provide their services robustly, that they could think of new ways of providing services that would reach more people, either more people in terms of different client groups, but also more people in terms of geography, because obviously one of the advantages around our approach to COVID has been the ways in which we've embraced digital technology, and that enables us to perhaps reach some of the geographical areas that might otherwise cause us a difficulty in terms of the challenges around recruiting into those areas. So I think we've done a lot of work and we're sensitive to this as being an issue, but I think your challenge is absolutely legitimate. We probably don't have a very strong barometer or good metrics of what impact or triggers there might be. I mean, we do have figures around things like completed suicides and attempted suicides, but those would be at the very extreme end of that continuum. And these are matters that we take very, very seriously, of course, but what we're looking to do is increasingly ensure that we're putting in place with partners the sort of provision that will mitigate people from becoming so unwell that they need statutory services. So a lot of it is about our work with communities and in the third sector. But that's maybe something that we could look at moving forward, because Pan-Tayside, there is a quarterly, there's a performance review group that meets on a regular basis and provides a report on a quarterly basis in relation to mental health services. And it would be important that rather than reporting on how we have reacted to things that haven't gone well, we were better able to report on how we are preventing things from reaching that stage and demonstrating perhaps more robustly through data, as well as case studies, for example, what difference we are making in terms of early intervention and prevention.
Thank you, Chief Officer. Mr. Erskine, did you want to come back on any of the points raised in the answers?
Yes, Callum, if you don't mind, just briefly again. I suppose partly where the question on data came from is a little bit about ownership of mental health and well-being for the Perth and Kinross community as a whole. And the IJB has got a role, the council's got a role, the health board's got a role, there's national public health bodies, there's a lot of people with roles. I'm just trying to get a handle on, you know, everyone can exist in silos, but the whole system approach of all these bodies working together, you know, and how do we ensure that we're picking up on issues, but then also following through and making sure that we're addressing them, as you say, Gordon, preventing situations before they get worse. And obviously just through reading the press nationally and locally, there's loads of data out there now around how certain groups, age groups or sort of deprived groups, or all sorts of groups, BAME groups, are affected in different ways. Was trying to get a picture of how all that gets pulled together in the Perth and Kinross area, and how we develop that holistic view and then try and influence partners to meet what that need might be. So I think it sounds like it's a work in progress, or it's a journey. But I'm pleased that we're doing some work in that area, and I think there's more to come.
Thanks, Ronnie. If I could, Chair.
Yes, Chief Officer.
I mean, your points are well made, and we'll take further, we'll take stock on what more we can be doing. I mean, it probably should be, I should certainly mention the work that some committee members will be aware of around the development of our local community mental health strategy, which will be informed by the available data and will be now, you know, designed through the lens of COVID. And that alignment that the local response is going to have to that Tayside-wide strategy that's being advanced through the work of Kate Bell and colleagues. So that work is in train, and certainly there may well be, I might be doing colleagues a disservice because there may well be more information than I'm currently privy to. And if that's the case, I can certainly, you know, bring that forward out with the meeting. But otherwise, I think your points are really important for us to reflect on as we move forward. So thank you for that.
Thank you, Chief Officer. I'll bring in Sandra Auld now, who wanted to make a comment.
Thank you very much. Just on the discussion that's been ongoing around mental health and data, I don't think that excuse me, in common with the national position, I don't think there is data or the systems in place to collate data, and maybe this is something that Perth and Kinross IJB could set themselves up to lead the way on. There was a parliamentary debate last week on the Health and Sport Committee report on supply and demand for medicines, and a very critical report. And as part of that report, made comment that there was no usable data within the NHS in Scotland, in particularly in reference to medicines. But data systems, as you know, I think we're all aware that it is something that's really lacking, and as I say, you know, there's a real opportunity for some work to be done. It comes back to, again, a previous discussion around capacity, you know, the capacity to do that. But I would also link into this, whilst Ronnie's question was around patients and users. I also have real concerns about how we're monitoring how staff are coping within this situation. I think I'd really like to know that we were monitoring, you know, and we had concerns about their well-being as well from a mental health perspective. Thank you.
Thank you, Chief Officer. I don't know if you wanted to briefly respond to that.
Certainly, that latter point is something that we're very attentive to. We're looking at how we can do more to support staff and what that might look like. There are opportunities for people to be connected into some of the wellbeing resources and opportunities for people to take time out and to be supported by their managers and by their colleagues. But I think increasingly it's the case that because we've seen our COVID experience has perhaps changed from the sprint that we first anticipated to the 10K it became, to the marathon that it is now, that we are seeing that staff are tiring, that there is a degree of fatigue, and there's challenges to people's resilience. So it is something that we're actively looking at. What can we do to redouble our efforts to ensure that staff are well supported and also are able to, you know, take breaks to recharge their batteries, and to compensate for some of the challenges around the virtual world that so many people are now operating in, where you can obviously lack the same sort of personal connections that you previously might have relied on to support you in your work. So there's a number of areas that we're looking at because, as Sandra's highlighted, this is an area that we have to be very attentive about and concerned about. So just to provide that reassurance.
Thank you, Chief Officer. Okay, I'm not seeing any further requests for questions or comments. So in the absence of that, if we can agree to note the report, thank you very much. The final substantive item on the agenda is an update from Lindsay Bailey, who is the locality manager for South Perthshire and Kinross. We've been trying to go around all of the different localities to see how the Health and Social Care Partnership is delivering on the ground, and very much looking forward to hearing from Lindsay on this. Thank you. Lindsay, I think in order to hear from you, you might have to unmute.
That would help, certainly. Is it okay if I share a presentation?
Yes, absolutely. If the tech people can.
Can you see that?
Yes.
Okay. Okay. So I'm Lindsay Bailey. I'm the locality manager for South Perthshire and Kinross. I'm also the service manager for psychiatry of old age inpatient services. I just wanted to, I didn't do a paper, but I just pulled together a presentation to talk a bit about the locality and a bit about how we're working on the ground, but also a bit maybe around, it was quite interesting to hear your conversation around COVID and how things have been for us and for the teams and for the people that we're caring for. So just a bit of background, this is obviously the area that South Perthshire and Kinross covers. I would highlight at this point that the Carse of Gowrie within this locality is covered by health but not by social care. So any of the information that I do give you today and data is only for the orange area. It does not include the Carse. So obviously we have sort of major settlements as in Kinross, Auchterarder and Crieff, and we have teams that sit around the GP clusters in that area. So this is 2018 information. So the population for South Perthshire and Kinross is about 49,460, with 28% of people in the least deprived quintile and none in the most deprived. The average age expectancy is 81.7 years for males and 84-year-olds for females, and 20% of the population have at least one long-term physical health condition. 16% of the population are being prescribed medication for anxiety, depression and psychosis. However, it'll be interesting to see how that changes over the coming years. In 2018 to 2019, the locality had, you'll see there, 9,023 emergency health admissions.
Lindsay, sorry, can I very briefly stop you? I think that, have you moved on the slides? Because we're still on the first slide. I just noticed.
Okay. So is it not moving, Callum?
No, we can still see the first one.
Lindsay, if you just click on the one on the left-hand side that says 2, it should change it.
Yeah, I seem to have come off the screen altogether though.
Ah.
Wait a minute. Okay.
Well, it's jumped to number 8 now, so there we go.
Right. Can you see that?
Yes.
So have you seen that one?
No, that's quite further on, I think. I think you need to go back to the start.
I think you were on maybe number 3 or something.
3,
like
I think, yeah.
So that's number 3.
I think we're still saying
student 8 at the moment.
Your delivery model.
If you just like, that's it, it's moving now. It's just maybe just going slow.
Okay, so are you on that one? Is that the
5? About the management group.
No. I'm not on that one. Would it be better if I just didn't do the presentation?
If you want to stop sharing, Lindsay, I could maybe try and open it up at this end and see.
Okay.
Or a colleague could rather.
I was going to say, Lindsay, I had this issue in a different meeting last week, and the way it was resolved was just by clicking on the picture of the slide. on the left hand side, you know, the presenter manually.
Ah, yes.
That
Yep,
seemed to
yeah.
work.
Okay. I seem to have lost it altogether now. Let's see. I'm not managing to share it again. I think it's closed. Can anybody else share it for me?
Yeah, we'll get that up in a minute if you just give us 2 seconds.
Okay, so can we maybe go to the 3rd slide? That's it.
That's it.
Yeah. So so this was the one where I was talking about the age groups, etc., and the population. Maybe if we move to the next one, number 4. So this is where I'd started around the emergency hospital admissions per 1,000 population, and 64,246 unscheduled hospital bed days per 100,000. There were 18,928 A&E attendances and 8,599 delayed discharges. That is in days. There were 673 falls admissions per 100,000 population, and interestingly, when we've done some data collection around the falls that happen within and are recorded within health, we have found we're a bit of an outlier and have quite a significant increase in the falls that happen in our population. So that's a piece of work we intend to look at over the coming year. There was 95 readmissions within 28 days and 1,175 potential preventable hospital admissions. And I suppose that something that is good practice is that people over the age of 65 spent 93% of their last 6 months of life in a community setting, which is something obviously we aspire to do. So if I move you on to the next slide, I want to just talk a bit about the South Locality Management Group. So across the locality, we have a locality management group which meets currently every month. We have a very inclusive membership within that group, so it's chaired by myself or Alison Fairley, who is my local authority partner, and we have a very inclusive membership of the locality management group. We do not have just the team leads and the higher sort of grades within the locality. We have people who can bring something to that management group. We have our engagement workers who attend. We have our organisational development teams who attend to support us moving forward, and we also have our healthy community staff who come along to this, so that we are inclusive around all the things that we're trying to achieve. The management group provides leadership for local planning and delivery of services, and specifically has an action plan to identify locality actions and oversights of the progress that we're making. The action plan at the current time, we're in the process of renewing around the response to COVID and around the remobilisation. But also the action plan is designed in line with the strategic plan, so it takes the themes of the strategic plan and looks at how we are delivering that in the locality. It has a very robust participation and engagement plan, and I'll talk a bit more about that as we move on. And it's used as a forum where we can share information about each other. I think we need to make it more robust. We are looking for a carers representative to join us in our management group, but so far we haven't been able to achieve that, and only because we tend to find in the more rural areas it's actually managing to get carers and service users to join these groups can be a bit trickier. But I'm hopeful maybe with new technology it might be something that will be easier to do. I think we heard that at the carers conference. Actually, carers are able to probably attend a lot more and do more now with technology. We can move on to care and professional governance, the next slide. So as you'll understand, the care and professional governance, we have a locality care and professional governance meeting. That meeting is an integrated meeting and includes both health and social care. We look at sharing the best practice and learning for the benefit of locality teams, but also for the benefit of sharing with our other colleagues across localities. It enables us to provide some evidence that care delivery is safe, clinically effective and person-centred, and it reports by within the meeting we have exception reports from individual services in the locality, and we have these on our every meeting. It ensures that the locality services provide some evidence that they're aware of any risks to effective service delivery and care. So at that meeting we discussed any risks that are within the locality and any service risks that we have recorded on any of our systems. It provides assurance and information to the P&K, Care and Professional Governance Forum, and actually we've just reported on our second cycle of our annual report, and I'm sure that I'm more than happy for that to be shared if anybody should want to see it, but that gives a very sort of overview of what we've been doing in the locality. As part of care governance, we can record how many complaints we've received, and from April this year till now we have not received any complaints in the south locality. And we've also I think we've had 4 layers, and these are local adverse event reviews for incidents that, number 1, were either a red incident or we feel there was learning from. And these are included in our reporting into the Care Governance Forum. Move on to the next slide, please. So a wee bit about our participation and engagement plan. So we have a robust participation and engagement plan that can also be shared, and I think it's actually included in our annual review. So what we like to do is it's about information and how we improve information available to local population. A lot of the themes in the participation and engagement plan had started off with the initial engagement that was done around the strategic plan, and what we've done is we've taken these themes and looked at what people have told us. So the information, we've got some understanding in there, and people wanted to tell us that they find it difficult, they struggle to navigate in the health and social care system, and again about dialogue, co-designing, bringing people together, and that's about some of the engagement that we've done with local people around what they want to see services look like and how we shape them, and also participation, and that's about allowing people to have that input. I've listed there some activities that we did undertake, and I think it's really helpful to understand that one of the things that we looked at the start of the locality was how do we actually speak to local people about health and well-being, how they are, how do they feed into us. So in each area in Kinross and in Audit and in Crieff, we have health and well-being networks that we support, and not, we don't lead, but we are part of, and go and we hear from local people and local third sector groups around what's happening, what they're doing, and look to see what we can support them with. So there's been a lot of activity over the years. There was some participatory budgeting and partnership with Local Action Partnerships a number of years ago. There is a South Perth newsletter that's also distributed. That's, I think, biannually, and that's sent out with updates of what's happening. We had an open event in Crieff Community Hospital, and we're now just realising some of the input from that from local people, and we're nearly at a point where we're going to be opening the garden there to provide some dementia walks and dementia friendly stuff. And I think now at this point, because of some of the safer working, and also because of some of the issues with COVID, it will allow some of our groups that maybe haven't been able to meet to actually have somewhere where they can, and they can do that safely. And we also had work around the Bridge of Earn health and wellbeing engagement, and that was about 2 years ago, just around about just before the closure of the GP practice, which gave us a lot of really good information around what we needed to do in the Erne area, and we're continuing to build on that at the current time. So there's a lot. The locality has been quite involved in participation and engagement. If we move on, please. So the locality care delivery model. So all our social work. So this is, when I talk about our care delivery model, I'm not talking about health or social work. I'm talking about it together, which is how we deliver moving forward. So we have the links model. The South commenced links in June of this year, and until today we've had 107 referrals into our link service, where we're supporting people to remain at home and to prevent admission, but also to provide that person-centred care delivery at a time when people are beginning to, their physical health is starting to deteriorate. So it has proved to be really successful in the South. We've done a lot of engagement prior to going live with our GP colleagues to make them so that they were aware of what the service was and how that would work. We have an integrated adult care team, so every week, over and above our links daily meetings, we have an integrated meeting. Now that integrated meeting has been going, and this is with clinicians, social work, and our Healthy Community Collaborative, and also our social prescribers. But that meeting has been going now for, I think we're on 4 years. It meets every Thursday, and that's a forum that, as links has progressed, that forum has now more become about our concerns about any carers, if people are in caseloads, to proactively look at people who there might be an adult concern around, so that we don't reach a point where there's a protection issue. So it's a meeting that's attended by everybody who is involved in the locality and clinicians. So that's proved to be something that the teams have found really valuable. We have mental health and wellbeing, so we provide mental health services for older people and for adults. We currently have been looking to bolster our adult mental health team because of acknowledgement that in the South locality we had a very small team. So we have increased some funding from other areas into that area because we're aware it's the adult mental health team was so small. We have the new primary care nurses who work with the practices through the PSIP funding and through the new GMS contract to support people with mental health issues that the GPs would want us to see, and that has continued, albeit by near me, but that has continued over the pandemic and continues to do so. In the South locality, we did not step down any adult mental health services. We continued to provide as much as we could with the recognition that it was a difficult time for people with mental health issues. Our older people's community mental health team services continue to support our older people around post-diagnostic support and looking at how we can start to remobilise. But we have seen an increase, I would suggest, in some carer crisis for our older people with some dementias, and we are seeing a lot of our clients who maybe are more unwell than they would have been before, and that's really due to carers trying to keep people at home and trying to support them as much as we can. So that's a piece of work we're looking at the moment. The primary care models, we obviously are delivering and have started to deliver the community care and treatment models under the new primary care contract. And last week actually successfully opened Bridge of Erne as part of that model. So we're continuing to develop that with moving into phlebotomy and delivering the services for the new GMS contract. Our care is a piece of work ongoing through a group across Perth and Kinross looking at care at home, but we're also looking at how we support our local care homes, and we have pre-COVID and moving onwards, we have a locality care home meeting where I go along to hear about any concerns and to be able to provide any information around how we support care homes. But care at home, there has been problems with recruitment into care at home, and that's mostly due to rural areas, but I think it's not something that's unique to the South locality, but we are looking at how we support more sort of self-directed teams and looking at new models for that. to the pandemic, but prior to the pandemic, I mean, I have made reference to the health and wellbeing groups that we have in the locality, but there's been a lot of work around the stronger communities and how we move forward with that. So I'll talk about that a bit later on. So if we can move to the next slide. I appreciate it's a bit of a whistle-stop tour. So the South remobilisation, so I suppose a lot of the focus that we have at the current time is around, so there's carers, and we recognise that our carers in the locality need support, and we're looking to see how we can make that stronger. We've obviously had Carers Week and the Carers Conference, so it'll be interesting to hear some feedback from that. But it is about how do we support carers, how do we encourage them to see them, you know, the unpaid carers, to see themselves as that. We are looking at a dementia strategy and how we continue to support people with dementia. There is the Scottish Government are about to release a new dementia remobilisation policy. The policy was due to, the dementia policy was due to be renewed this year, but that's been delayed till next year. But in the meantime, they're going to provide us with a framework for moving forward. We are looking at keeping people safe, and that is about our more vulnerable people in our locality, and how do we keep them safe, how do we support them, especially at times of isolation and not being out and about. So that's a piece of work that Alison Fairley, my counterpart, is particularly interested in, is looking at pulling together a group to specifically look at that. Mental health and wellbeing is a big one, and that's not just about our local population, it's also about our staff. How do we support them moving forward, and how do we make sure our local population feel that they're well supported. In the South, we do have some active groups from a mental health perspective, and we're continuing to liaise with them and make sure that we're keeping them supported. We're looking at person-centred care and support, so that is about person-centred care planning, primary care delivery I've talked about, and obviously it becomes more apparent as we move through the flu vaccinations, now moving on to a COVID vaccination. That's something that we will have to consider from a locality perspective. The public health strategy, so we're keen to look at how we tackle some of the inequalities, and I will talk a wee bit further on about some of the work that we've done from a stronger community perspective around that. But we are, I'm aware, acutely aware, that possibly as a partnership and within the locality, the public health, we've maybe not been as strong as we could be, so that's a piece of work for coming year. Self-managing teams, the locality's been interested in the neighbourhood care network that is through the SSSC that's been happening over the past year, 2 years. The locality has been quite involved in looking at that, and wanted to, and will do over the next year, look at some self-managing teams and some work around that to see how that would work for people. And the stronger community agenda is something that we need to continue to grow on. There was a lot of work done through the COVID pandemic, specifically in Kinross, around Kinross kindness, and also in Crieff, around Crieff Connections, and we want to look at how we continue to work with them and support that. If I can move on to the next slide. So this is the health and wellbeing in the stronger communities. Just a couple of things I think we wanted to point out here is we have a health, and I've talked about the health and wellbeing groups that we have across the locality. We have a Locality and Advice Hub, which was, we worked with Broke Not Broken in Kinross, and our healthy community worker was really, and still is really, involved in looking at how we support people maybe to access services when it's hard for them. So the Locality and Advice Hub offers the opportunity for citizens' advice. It offers opportunity for people who maybe have issues around technology and digital solutions. So that's something that we deliver in partnership with Broke Not Broken in Kinross. We have the Crieff Connections, and that's formed, it's become stronger through the COVID situation. So our engagement workers are really involved in feeding back to us what Crieff Connections are doing, and for us to try and support the work they do. We have really active men sheds in the south. We have Kinross, which is way ahead of the pack with regard to men sheds, and they have been absolutely outstanding through the pandemic with providing us with support around things like key safes, but also in PPE production. We've got recovery cafes, which have started again, and that's to support people who have addictions in the locality. So we have a really robust one in Kinross that's been running for a number of years, and we also have one in Crieff, and we're looking to see how we can continue to support people at this time. We've done some feedback collaboration, especially in Crieff, where we've supported the food bank to use our premises to enable them to keep going. And that's proved to be a really collaborative approach, in that some of our teams now are more aware of food banks and support that and support models going forward. And it also provides an area, I suppose, for us to be able to contribute to. So that's been really helpful. And the compassionate communities and compassionate Crieff, this is a piece of work that we've, along with the Local Action Partnership, we managed to receive some funding. We haven't managed to use that as yet, but this is about the Inverclyde Compassionate Community Model, where we are looking at how do we support our people who are coming towards their end of life in our locality, and we are looking at hospital to home boxes and things like that at the moment. So we're also doing that in partnership with Giraffe, who are supporting us to take that forward. So that's another piece of work that's moving on. We also have the Sparks group in Kinross. This is another really strong group who's now a constituted group in their own right, and they are really active, and they're active participants in supporting us, and also the Local Action Partnership around moving some stuff forward around disability access and things like that. So there's been a lot of work around stronger communities, and I think it's really important that we've just had 2 workers who have gone to do the digital inclusion training, and it's important that we support them to roll that out across the locality moving forward. I'll take you on to the next slide. I want to talk a wee bit about the team development that we've done in the South. So we have developed a mission statement, and at the end I'll leave you with that, but we were involved with the SSC on a research programme a year ago, and that was, there was some sites in Stirling and ourselves where we looked at our integrated working research report, and we have an action plan that's fallen out of that. So that's about how we are integrating what makes integrated services work, and I think that was a really good experience for the team. We've done, there's been a lot of work around the learning that's happened through COVID, and what's that meant and how it's changed our services, and everybody had the opportunity to feed into that, and we have a lessons learned, and we are looking at an action plan around the learning from COVID, and it's what do we continue to do and what do we not need to do anymore. Staff health and wellbeing is obviously, I've talked about that previously, and the Near You, Near Me, Stronger Together community. I'm working with myself and the management team are working with organisational development to look at doing a QPR coding thing in Crieff to start to tell stories about who we are, what we do, and how we can support local people. So that's something that we plan to take forward over the next year. If I move on to the next slide, this is really just, I just wanted to describe to you. So this is the framework for community health and social care integrated services compiled by the Scottish Government. And I think just to say that I could probably talk around all of this, but I'm aware of the time, but this is something that we would plan in the South locality. This is something that we plan to measure ourselves around, and this is around the sort of care, and it talks about how well we best integrate teams. So I won't go through all of this, but it's just to say that as a locality, we plan over the next year to start to look at what parts of this we're doing well, what parts of this we're weaker on, and which parts we need to move forward with, because we are always developing and bringing in new services. So it's something that we want to do. We'll work with our GP clusters. We have 2 GP clusters in the locality, and I think I'm really keen that we involve them in the work that we're doing here, because they are part of what we do. If I move on, then I'll just really leave you with our mission, statement. So we had a real development day, and the report can be seen where we had all our teams and the teams who work in our locality come together to look at the sort of the mission statement for us as a group and as a team. And this is what the teams and the people working in the South felt was our statement, and that is that we will work together locally to support you to live your best life. So that's really a whistle-stop tour of the South locality, and I'm happy to take any questions.
Thank you very much for that. That was really good, very comprehensive, as you say, got through quite a lot. I certainly clocked all of the references to how fantastic Kinross and Kinross is, whether you were deliberate or not. I'll ask if there are any questions from other members of the committee on Lindsay's report. Sandra Old.
Hi, hi there, Lindsay. Thank you very much for that. Really impressive, the amount of work that's ongoing. It's just to mention that carers and service users have a reference group which is meeting on Wednesday. And this is actually the kind of presentation that would be fantastic, maybe not for this week, but for a future meeting, just to make it, to get it out there, you know, some of the work that's ongoing. I noted that you mentioned that you were looking for a carer representative. If you could maybe email me afterwards with just what it is you're looking for, what the kind of commitment would be, then I'll bring that up on Wednesday and see if we can possibly find someone to contribute.
That would be great, Sandra. Thank you.
Great. Any further questions or comments? Okay, well, thank you very much for that presentation. That's been really useful. And as I say, we like to hear what's going on the ground across Perth and Kinross from the Health and Social Care Partnership. So thank you again.
Thank you.
Okay, just finally, we have two items for noting. One is the work plan for the Audit and Performance Committee, and the other is the record of attendance. I'm just going to ask if anyone has any issues with either of those or any comments. No? Okay. One additional thing, we have to do an annual report each year. What we're going to do is send that to members of the committee after this meeting and ask for feedback on a draft of that. If you could give your feedback and also whether you're happy with it or not, then we'll hopefully be able to agree that. So that would be very helpful. The details of that will be in the email. Just finally, I want to ask if members have any issues that they want to raise in private discussion with internal audit. No? Okay, well, with that, we'll close the meeting. Thank you very much for your attendance, and thank you for all your questions and the answers from officers too. We'll look forward to seeing you next week at the IGB. Thank you.